Okay, right to go?
Yep.
All right, thanks everyone for joining us here again this morning. Joined by the Chief Health Officer, Professor Sutton, and also our SES Chief Operations Officer, Tim Waybush. Brett has AHPPC, so we'll need to leave the conference at 12:30, so I'll speak for a few moments, then we'll hear from Brett and then from Tim, and then we'll go to questions to Chief Health Officer, so we make sure that Brett can get to his AHPPC meeting. I want to start this morning with Tim here to thank all of our thousands of SES members who have been working so incredibly hard in sometimes quite dangerous situations over the last 48 hours, working around the clock to respond to call-outs, to make homes, communities safe as the clean-up starts from this wild and devastating weather. And what we do know is that it is not over yet. It was quite extraordinary leaving home and driving through the Dandenongs to work this morning, having a few different routes having to go through to get off the mountain, just massive trees across homes, across the roads. So my thanks again to all the wonderful SES volunteers and to everyone in our emergency services for the work that you do. Thank you. Tragically, one person has lost their life, and my thoughts and prayers are with this person, with his family and friends at this very sad time. In the last 48 hours, there have been over 7,400 requests for assistance, and there are still more than 121,000 homes that are without power. There are weather warnings still in place across the state, and as I said, Tim is here to go through an update on conditions and also an update on recovery efforts. In terms of the COVID update, there are 0 locally acquired cases and 1 new case in hotel quarantine for a total of 75 active cases. It's the first day we have reported 0 cases in the community since the start of this outbreak. That is good news, and it's news I know everyone in Victoria wanted to hear. So let's take a moment to catch a breath just for a moment. Thank the many thousands of staff who are out there, contact tracers, people supporting our testing and vaccine programs in our pathology labs, to the thousands of people who are isolating to keep themselves and to keep the community safe, and to all Victorians who have followed the rules. To get to 0 cases today is a terrific outcome, but it is nowhere near over. We cannot be complacent, but it is good news that we're at 0. 20,752 people got vaccinated yesterday at our state-run centres. Another very solid day, boosted by the second day of our priority blitz for Ambulance Victoria staff. We had 17,604 tests yesterday, which is good, particularly given the extreme weather conditions. However, in some areas where we really would like to see an uplift because of community transmission, it was lower than we would have liked in some parts of Melbourne. So my ask of Victorians is this: if you live in the Craigieburn area and did not go and get tested yesterday, please go out and get tested today. Please make plans to go and get tested immediately. Testing is the best way for us to know where we are, how we're tracking against this virus, especially now that we have further eased restrictions that came into effect at 11:59 p.m. last night. What those changes mean, in essence, is more people will be moving around the city. People will be gathering outside. People will be dining in. People will be going shopping, getting married, and doing the things that they love. That's a great thing, and we have all sacrificed to get to this point where we're at today. But to keep easing, and to keep us safe, we need everyone to get tested straight away when you have symptoms. So if you are watching right now and you've got a runny nose or a cough that's bothering you, or you've just popped some strepsils, then you know what you have to do. Go and get tested, isolate at home until you get the negative result. It's also critical as we start to open up to check-in using QR codes when you're out. This is so critical. As previously flagged, we'll be moving to make QR check-ins compulsory compulsory for all workplaces. We're consulting with industry today and over the next couple of days in terms of how we implement that. This is now in the Chief Health Officer's directions. However, the amnesty around enforcement is in place for another 2 weeks. We know this has been an anxious time for many Victorians whose surgery was delayed due to the pandemic. So I want to advise the Victorian community, Melburnians, from Tuesday next week, hospitals in Melbourne will be able to restart their normal elective surgery lists, giving Victorians certainty that they'll get the care that they need. It is not as simple as flicking a switch. Our hospitals need some time to scale up their staff and resources to ensure Victorians have elective surgery. Victorians having elective surgery continue to receive the world-class care our health services have always provided. So we'll be working very hard to clear that backlog as quickly as possible. We're currently in the midst of a $300 million elective surgery blitz. We provided a further $136 million in the budget just a few weeks ago. That's the equivalent of a further 18,000 surgeries. That was delivered in the budget the last couple of weeks. We've got elective surgery already started in our regional hospitals. Tuesday next week, we start ramping up elective surgeries in Melbourne hospitals, but it's always important to absolutely clarify for Category 1 and urgent Category 2 cases, they have always been able to be delivered throughout this pandemic. But I wanted to clarify exactly where we're up to in terms of elective surgery. I'll now hand over to Professor Sutton to go through some further detail. We'll hear from the SES Chief Officer, and then we'll open up for questions. Thanks, Brett.
Thanks, Acting Premier. Good morning. So, of course, it's terrific to see a day of no cases in Victoria, no locally acquired cases, one in hotel quarantine. And as the Acting Premier said, huge thanks to all of those, especially involved in testing, those who come for testing, really every Victorian who's thought about their symptoms and gone and got tested at the very first sign, all of the path labs that are doing that testing in huge numbers still, and all of the testing site staff, as well as the hospital staff who continue to care for the few patients who are in hospital. But the week ahead probably won't be all zeros. We've still got thousands of primary close contacts, some of whom may well become positive. That's not a concern as they quarantine for their entire period. But it's only been 48 hours since we've had cases of uncertain acquisition. So the family that have travelled to Queensland and the Reservoir household are both still under investigation for exactly how it might have been acquired. So that's a real lesson that we may yet see cases. There's still lots of investigation to go and a really strong reason for everyone with symptoms to get tested, because you might be part of those unknown chains of transmission. So we really do need to keep our efforts up. All of those things that are still in place in Victoria are part of those efforts, including wearing masks indoors and out. They are measures that work to reduce transmission, to reduce the opportunities for contact with others. We do, nonetheless, continue to release a number of primary close contacts, especially as they receive their negative day 13 test, complete their 14 days of quarantine and go about their lives. We, as of yesterday, had 4,300 primary close contacts, having cleared another 900. So we're working through those bit by bit. They've all been staying home, doing the right thing, and my huge thanks to them. Yesterday, the public health teams continued the rapid response to the new Reservoir household outbreak. 4 household contacts have tested positive. No clear acquisition source as yet. Obviously, in terms of managing those cases, their primary and secondary close contacts have been identified. Some of the critical primary close contacts have already been tested and tested negative, but we, again, need to look as to where they might have acquired their infection and keep investigating all of those close contacts. The genomic sequencing's come back for that family, and it does suggest a Kappa variant, so it's consistent with the City of Whittlesea and Port Melbourne and aged care cases all being of that variant. Following interviews with the positive cases, there are a number of potential exposure sites, but also acquisition sites, so where they might have been when another infectious case was. So please go to the website through the course of today. It'll be continuously updated just to see if any of those most recently added exposure sites apply to you and act accordingly. There will be some blood testing done for some of those cases as well to try and determine really how far into their infection they are, again, when it most likely began for some of those cases, to help us investigate exactly when it's been transmitted and where. We're also obviously looking into the source of exposure for the 2 Queensland cases. Following long interviews by the Queensland health authorities and New South Wales health authorities, they've also gone through a really long interview process with us. We do thank them for that. It's a tiring process, lots and lots of detail around where they've been. We are looking, quite a bit earlier than the 1st of June again for that acquisition, for where they might have picked it up. Whether or not they were infectious through that whole period is difficult to say. It does seem to be that they were right at the end of an infectious period when they've been tested in Queensland. So we have to go back some days to try and determine where they picked it up. But like the reservoir household, the variant of concern appears to be the Kappa variant for these cases as well. Additionally, we've had several new wastewater detections recently. You'd be aware of those found in Bendigo, but we've also yesterday had detections in the Glenroy and Pascoe Vale area and some eastern suburbs in Whitehorse, Manningham and Monash. So again, a call out to all of those who are symptomatic across Victoria, but particularly for those areas with wastewater detections. And it really is those high testing numbers that will not only identify anyone who's not been identified as a primary close contact, who might be one of those cases who's had casual contact with somebody else who isn't aware that they've been exposed and who might be carrying the coronavirus. So terrific testing numbers, but we must maintain them. We're kind of at the halfway point in many respects. A day of zero is terrific. We've got a lot to run for all of those primary close contacts, all of those potential chains of transmission to be run down. So please bear in mind. And there are many people who've been tested, who've gotten over an illness, and of course we're in winter, who've developed symptoms again. So if it's a worsening of some normal symptoms, if you've had symptoms resolved, but again you've got upper respiratory tract infection symptoms, sore throat, runny nose, cough, fever, you really must get tested again. We will all go through winter as Victorians, probably needing to test once or twice or 3 times. That is the only way we can be sure we know where coronavirus is and to run it out of the state. In the long term, vaccination is our key. Having 20,000 people getting vaccinated through our state-run vaccination centres, absolutely fantastic. At least that many through our GPs every day. 50,000 people per day getting vaccinated in Victoria is absolutely fantastic. And the higher and higher coverage we get, the better off we are. And it is our long-term way out of this. Thanks so much. Tim.
Well, good morning, everybody. It's certainly been a challenging 24 to 48 hours for our emergency services, for our local government authorities, for our power companies, telecommunications services here in Victoria as a result of the significant weather system we saw. We've now seen over 7,400 requests for assistance here in Victoria relating to firstly the severe weather and now also the onset of riverine flooding. Around 5,800 of those have related to trees that have come down, and we still have over 100 roads that are now closed as a result of tree carnage occurring right across the Macedon Ranges, the Central Highlands, into the Kinglake and Yarra Ranges, also obviously the Dandenong Ranges, but then down into the Latrobe Valley, all the way through to the Bass Coast. So there's significant work still undergoing today. There's around about 2,500 requests of those assistance still to be cleared, and we're bringing in additional resources. We've got SES and CFA volunteers coming in from all parts of the state to some of those affected areas. We also have Forest Fire Management Victoria that are now bringing in extra chainsaw crews to help clear those roads along the way. We also have the forestry industry that are now coming to the core with some of their large machinery, and so we are hoping in the coming days we'll be able to get some of those remaining roads open, with the largest arterial roads now being open. So there's really two major roads that are still affected by the tree carnage, which is the Mount Dandenong Tourist Road, but also the Maroondah Highway from Hillsville up to Narberthong. What we'll see now in the coming days as a result of the heavy rainfall is riverine flooding start to set in, particularly in Gippsland. We currently have three major flood warnings that are out for the Traralgon Creek, the Thompson River and the Yarra River. We have three moderate flood warnings out for the Latrobe, Mitchell and Werribee rivers. There are 8 minor flood warnings as well. What we have seen though is 42 flood rescues that have occurred in the last 24 hours. And we can't emphasise enough to never attempt to drive through flash flood waters. It could be the last decision you make. As a result of some of the riverine flooding yesterday, we saw 30 homes impacted around Traralgon, homes around Hazelwood and also around Maffra being inundated by floodwaters. The challenge for our community in Traralgon is whilst the river has receded and the Princes Highway has reopened, we are expecting to see another 80 to 100 millimetres of rain over the Traralgon catchment later today and throughout the night. The advice that we have is that will result in renewed major flooding, and we do expect to be reissuing an evacuation order for those communities sometime early this afternoon. We're also likely to see another 15 to 25 millimetres of rain right across the southern parts and into Gippsland, and 40 to 60 millimetres, particularly over those western and central catchments. What that'll mean is the rivers that are currently showing flood warnings will be staying at some of those levels perhaps for a little bit longer than they might otherwise have been. So again, we can't emphasise, stay in touch with your emergency broadcasters, make sure you're getting the latest information and warnings off the Vic Emergency website, emergency.vic.gov.au, and staying in touch with the Vic Traffic app or website for the latest road closures at traffic.vicroads.vic.gov.au. Tragically, yesterday, as the Acting Premier has already mentioned, we saw a life lost at Woodside. Emergency services were called just before 2 p.m. For a vehicle that was seen submerged in floodwaters. Rescue crews from police and SES were responded, but tragically that person was found to be deceased in their vehicle. Police are preparing a report for the coroner. What we'll see in the next 24 hours in terms of the flooding is some riverine threats on the Thompson River at Sale, with 30 properties that have already been door-knocked and likely to come under threat of flooding there, and the caravan park has been relocated. On the outskirts of Melbourne, in the upper reaches of the Yarra River, we're also going to see major flooding, and the Melbourne Highway and the Hillsville Yarra Glen Road have been closed this morning, and we're expecting to see half a metre of floodwater through that floodplain. That'll see the likes of the racecourse and around 20 other properties come under threat from those floodwaters. As a result of the tree carnage that we've seen across those areas I spoke about earlier, as of 9:30 this morning, there's 121,000 homes that are still without power at this stage. Some 45,000 of those had been restored overnight, but we're working very closely with the power companies to make sure we can gain access for them to get into the wires that are down. The good news is that the 66 kVA services are now back to some of those substations, and that will mean we'll start to see power coming back on. But AusNet services do inform us that, particularly in their footprint, it will be several days yet before some of the infrastructure can be restored and some of the power is regained to some of those areas. Again, we can't emphasise enough to stay away from fallen power lines, and that please contact your power distributor if you have not already heard from them at this point. In terms of telecommunications, we still know that there are around 100 NBN nodes and mobile towers that are currently affected by the power outages. We're working very closely with the telecommunications services and our emergency services to gain access to get generators into site or refuel generators at some of those locations, but access is being difficult. So it is being prioritised to make sure that communities can get their telecommunications services back as quickly as possible. And finally, just a reminder that regardless of the COVID restrictions, if you do find yourself presented with an emergency warning or you're being asked to evacuate, you absolutely can leave your home to move to a safer location. I'll pass back to Brett for questions.
Thanks, Tim.
In terms of the order regarding masks and outdoor use, now that you've identified a potential kappa link to the reservoir family of 4, does that give you some confidence that a decision can be made in the next few days to ease those restrictions?
I don't think so. Masks remain a really important intervention. I think Alan Cheng spoke to it yesterday. It still reduces transmission substantially. People move in and out of indoor and outdoor areas all the time, and it's not always easy to judge how close others are. It will, especially if both individuals are wearing a mask at the same time, reduce that risk of transmission. And transmission does happen outdoors. It is substantially less a risk. That's why we encourage a whole lot of activities to take place outdoors and for individuals to meet outdoors. But they still occur. And, you know, the Rose Garden outside the White House is a classic example of a super spreading event that happened outdoors. So it's not to be dismissed as an opportunity for transmission.
On that, when will you review that?
We review all the time, but as I said, we're 48 hours from mystery cases in Victoria. It's great that they're linked genomically, but we still need to run down exactly how they've been acquired. And some of these individuals, are still reporting relatively transient, contact in some of those exposure sites. So masks are those important measures that work in those areas as much as anywhere.
So you're saying today's a zero?
No, I'm not nervous about opening up. We've always said we'll do the minimum restrictions that are required, and it's a balancing act. You don't want to open up to the extent that there's a really significant risk of this variant, any variant, running away from you, because the risk remains, and so many lessons from overseas around what that looks like. We don't want that to occur. So we're moving by increments and we're moving safely. But obviously, we're not wanting to impose things that are excessive. But it's always under review because the risk remains until we've run all of this down.
So apparently one-off is a zero and one-off. Were you surprised by that?
No, I wasn't surprised by it. Obviously, all of those primary close contacts isolating at home has helped control this. All of the contact tracing work has helped to control this, and all of the great testing that's been done has allow us to find cases and then control them. So we're going to get days of zero. I expect there'll be more. I also expect there'll be days where we have new cases each day. So it's not over yet. We're on the right track.
Studies from overseas show that there's less than 1 RNA chance of getting transmission outdoors in normal life. And in fact, Mike Wee, professor from Canterbury Church, says there's virtually no cases we can identify that took place as sorts of outdoors every day. So do you have any other information or evidence to show that these are not right?
So the relative risk is about 18 times less than indoors. Now that's substantially less. That's not zero. And when you're running down every single case and when you're wanting no transmission to occur between people, it's a small thing for a short period of time further to continue to reduce that risk. It's obviously also tricky for people to know exactly how they picked it up or where they picked it up. So for any one of those cases of unknown acquisition, we can't find that it's been transmitted in the indoor places that they've recalled. That probably means it was in some other location. So it is hard to pin down for some of those outdoor transmission risks.
So what you're saying today, though, Professor, what you're saying today doesn't give much hope to businesses, particularly small businesses.
No, I'm not saying anything in relation to businesses. All I'm saying is that we are maintaining restrictions as we've laid out for this week, with a review each and every day, and it's looking good in terms of the control of numbers today as a zero, and days ahead.
But can you give them hope?
Some of those restrictions may appear to be contradictory to everyday Victorians.
I guess so. I think people look at the circumstances for their business and they're trying to make comparisons with other businesses. It is the cumulative risk of interactions, and I think, again, as Professor Cheng probably outlined a number of times, indoor settings, prolonged contact, physical exertion, singing and the like are higher risk, and so those are the settings that we're focused on in terms of maintaining restrictions. But we will get to a point where we're confident that there are so few cases, if any, that all settings can be open with appropriate controls.
Can you give us a timeline on that?
Cases. Last week there were mystery cases, got locked down. This week the 6 people mystery cases were opening up. Some people see that as very contradictory. Can you explain why that works?
Well, certainly we're working through all of the primary close contacts who remain in quarantine. We've seen some mystery cases, and they were Delta variant mystery cases that we didn't know where the first case might have been. We've now identified that first case, so there's a period of time prior to which it hasn't been in the community. We're looking at a couple of weeks of potential transmission. We've had high testing numbers, including in the 50,000 range over that period of time when we were looking for any other mystery cases. So to have 300,000 tests in a week or thereabouts is very reassuring. We're still wanting people to test, but we've had a number of days with no further cases identified outside of those primary close contacts. That is reassuring, but we're not opening up fully for that reason.
Just in terms of what happens next, and especially around giving people like to know what's going to happen. So what would cause you to crank restrictions up again? What sort of things or results should people worry about?
Of course, mystery cases where there are concerns about high-risk settings would be of concern. On the contrary, cases that emerge who are in quarantine are reassuring. I wish I could give certainty to people, a week in advance. A week is unfortunately like an eternity for coronavirus, because if there's something out there that hasn't been identified, that's transmission that's occurring potentially in really significant settings like aged care or disability services, or an essential workplace setting where there are loads and loads of interactions. So we have to be aware that those things can still surprise us. Overall, the awareness of this, people doing the right thing, people testing in high numbers, and the vaccinations that are occurring are protecting more and more people.
And can I just ask one more, if that's okay? Just going forward, is there any contemplation by the Victorian government of not a blanket lockdown? Is there any way you can do something like do ventilation audits of schools so you can say, yes, some schools can open and others can't? Is there any way you can not impose all of the conditions on everyone?
Every single measure that we're doing outside of these outbreaks, even during these outbreaks, to try and mitigate that risk of an outbreak occurring. That is the best insurance against lockdowns, in addition to high vaccination coverage. We're getting to a point where more than 50% of those over 70 are vaccinated. So if the virus is introduced into a room full of elderly people, much less chance of that becoming an outbreak. So vaccination and continuing to push and offer up the vaccine is a really key measure. But everything to do with quarantine, everything to do with maintaining higher levels of testing, they are all measures that reduce the risk of outbreaks getting to a point where they're out of control. The response to this happened at a point where the first case identified, there were already 4 generations of transmission that occurred. There were already a couple of weeks of this virus moving around. That makes it particularly challenging to manage just in terms of individual cases.
The issue that Dennis raised before about businesses. So 2 days ago you asked gyms to make a sacrifice to the rest of the state to not open for another week. And you've cited data saying there were 27 cases in a gym in Hallam last year. Now, the industry tells us that that case wasn't an actual commercial gym, that it was a warehouse-type friends setup, that transmission occurred there. And the industry have also told us they have data which shows that 6 million check-ins have occurred at gyms since November, so after the Hallam case, since the Hallam case, with no transmission at all. I'm conscious that the gyms may have been exposure sites, but can you see their argument there Why are you asking them to make this sacrifice for another week when they're not getting any Commonwealth support at all while they're staying shut?
Well, I can't address the issue of Commonwealth support for gyms, but it's not just on the Victorian data with respect to the Hallam outbreak. It is the international experience of gyms, including settings where people have been tested prior to being in gyms, where they've had spacing of individuals, where they've had density quotients effectively, and where they've tried to put in all of those disinfection and cleaning measures, and they've still had significant outbreaks. It is a reality that exertion indoors and prolonged contact becomes a transmission risk. I think the industry has absolutely done it tough. I know they are ready and willing to do whatever they can to try and mitigate the risk. It remains a high-risk environment.
If another outbreak occurs, would you recommend another lockdown?
I have never said that lockdowns are the first measure. They will never be the first measure. They will be a measure that we implement when we have to, and only when we have to. All of those things to stop outbreaks occurring are the things that we need to focus on. And as we have always done in Victoria, including with single cases out in the community, with the Park Royal transmission, with the Blackrock transmission, it was significant numbers, and they were still managed through contact tracing. We've had single individuals exposing a number of sites in Victoria without a lockdown, without a circuit breaker, because contact tracing does the job. It is a different story when you've got 4 generations of transmission before you find that first case, especially with these variants of concern.
Just picking up on what you said to Brad before, you alluded to the fact that if these mystery cases were tied to more high-risk environments, then you'd be more concerned. So does that mean that if we get mystery cases now that are tied to more high-risk settings, we could go back into lockdown? Each on their merits. We will see. There will be mystery cases who've had very little interaction. There will be mystery cases where there is quite a significant suggestion of where they might have picked it up geographically or otherwise. So, you know, no one-size-fits-all for making determinations around this, each on its merits.
Premier Berejiklian yesterday said that she had great confidence in her health system on 7:30 report as to never lock down again and try to avoid lockdowns. May I ask the Deputy Premier maybe, do you have the same confidence in your health system to not lock down again as Berejiklian does?
Well, I just reiterate the point that Professor Sutton has just made. Lockdown is not the first option. It is based on the nature of that outbreak. Now, we've had outbreaks in Victoria that did not require a lockdown, where we did not get advice from public health that we need to go into a circuit breaker. But given the generations of transmission, the large number of exposure sites, the thousands of primary close contacts, we had no option in this case, following the outbreak in South Australia and then the breach in South Australia, then the outbreak here in Melbourne. We had no option other than to go to a circuit breaker lockdown. But there have been other examples where we have indeed we have not had to go down that path because of the work of our contact tracers.
Premier, just on another matter with mental health, as your role as Minister of Mental Health, we've become aware of at least one mental health organisation that's been accused of falsifying suicide data to receive funding. Is this a concern, and potentially has it misinformed mental health policy?
To the first question, absolutely, this is a concern. I'm aware of these reports. My understanding is that the CEO has been stood down. There's an inquiry underway, and there'll be engagement between my department and this particular organisation. In terms of your second question around our response to the mental health and wellbeing impacts of the pandemic and our support for organisations, no, I'm not concerned about that. We look at a huge variety of data, whether that's ED presentations, eating disorders, calls to helplines, a number of those. Engagement with Beyond Blue, Lifeline. There's a whole range of data sets that we look at to work out where we need to provide additional support, and that's what we've done precisely with the most recent additional over $9.5 million to specific areas to deal with the impact of
I think
COVID.
Premier, lockdown's lifted, but on Victoria Health's website it said it's recommended that Victorians don't travel interstate. Can you provide us with the latest advice on that?
Well, the advice this week is that people in Melbourne are restricted to 25 k's other than education, work, caregiving, getting a vaccination. So they are the settings in place and they are understood.
So sorry, just to follow up, if that's all right. Just one follow-up.
Yep.
Sorry, so if your home is within 25 kilometres of the airport and you don't stop on the way to the airport, can you fly interstate?
No, you cannot.
Vaccination, a target. Brett Sutton seems to indicate, okay, the more vaccinations you have, maybe a bit less risk. But there's a ton of people saying even if you get 90% of the people vaccinated, you still get deaths. There's some modelling from the Burnett. Do you have a number in mind? Like when does vaccination rates actually mean lockdowns are less likely?
Yeah, I'll answer that, and then I'll get Professor Sutton to supplement. And as we heard, a similar question was asked yesterday, Raf, of Professor Cheng, or in recent days anyway. There's no magic number. 70, 75%, 80% or more. There's no magic number in terms of herd immunity. But what we do know, and what the evidence does show, is that when you have a greater proportion of your population fully vaccinated, or at the very least with the first dose of the vaccine, 10% is better than our current 2 to 3% of our population. 20% is better than 10, and so on. So the greater percentage of our population that is vaccinated, particularly fully vaccinated, then that does have a positive impact on the transmission of the virus and the impact of our broader community in terms of the health impacts if someone does contract the virus.
When does it make lockdown more likely, though? When does it make lockdown less likely? Is there a point when it actually makes a lockdown less likely?
Well, I'll get Professor Sutton to go into detail. What we do know is that our path out of this is the successful rollout of the Commonwealth's vaccine program and purpose-built facilities for people who pose the highest risk for our community. That is the path out. In terms of individual outbreaks and circumstances, they are dealt with on their merits. Where you've got a localised, contained outbreak, the contact tracers can get in and do the job quickly, then the public health advice, like it has been at Black Rock and with other outbreaks, that we don't need a circuit breaker intervention. Where it is widespread in terms of exposure sites, primary close contacts, generations of transmission prior to us becoming aware, then we may need a circuit breaker lockdown. But to those questions, I think it's appropriate we hear from Professor Sutton.
Okay, just following on from that question before. So Victoria's government can't stop people from going interstate, though, if other states are happy to receive Melburnians?
Well, as I spoke to yesterday, relocation, for example, is not a contravention of Victorian directions, but that will be based on the arrangements that individuals have in terms of where they're relocating to. But the rules are very, very clear. For Melburnians, for this next 7-day period, we've got a 25-kilometre limit outside of those exemptions that I've talked about. But back to your question, I'll go to Professor Sutton.
Thanks, Acting Premier. Certainly every bit helps. With respect to the risk of lockdowns, every bit helps, whether it's another 2%, another 5%, another 10%. We're adding, almost 1% per day, which is fantastic. There is that randomness about who that first case might be in the state. If they're in a household where most of that household is vaccinated, that can be totally game-changing for the risk of transmission. So every little bit helps. In terms of that magic herd immunity threshold number, that is really difficult. It does depend on the vaccines that are used and in what proportion. Other variants of concern that might emerge, if they're more transmissible, it's trickier. If they've got immune evading capability, it's trickier. But it's still the case that more helps, and the higher the proportion, the better off we are overall.
Can I just do one more follow-up?
Ask you something before. Back to you.
Yeah, go.
There are many personal stories. We get heaps of 3AW partners who can't be with loved ones for procedures after miscarriages? Is that one of the sacrifices that we all must cop to beat this COVID? That's just one situation.
There are so many sad stories, and there are so many struggles that people report on. My heart goes out to them. I cannot fathom what it's meant across Victoria through a lockdown and through all of the circuit breakers and lockdowns across Australia. We are doing this with the minimum kind of restrictions that keep us safe. The alternative of this running away is too awful to imagine in some respects. We would always work to keep a cap on cases, but if it means longer lockdowns and more stringent lockdowns, that's terrible. If it means letting it run and, as some modelling has suggested, thousands of deaths, that is awful. And so these are the dilemmas of public health decision making. And as I say, awful stories with people, and you cannot but feel great sympathy for people's individual struggles. It weighs on me each and every day. I always have in mind what the alternative would be. And so these decisions are absolutely to try and keep Victorians safe, but also safe from what it would mean for a longer lockdown or a more stringent lockdown, because a variant of concern that is as infectious as the Delta variant or even the Kappa variant can really infect thousands of people within a matter of weeks.
Last question from Brett, please. Thanks. On vaccines, is there going to be any discussion in AHPPC, or do you have a view on whether eligibility ages can be changed? For instance, could more over 50s, say 50 to 59, have access to Pfizer to maybe boost the number of people who are getting vaccinated? Or, and I understand also Jeanette Young this morning also raised that the definition of an adult in Queensland will be 16. I'm just yet to clarify whether she meant that anyone over 16 can get a vaccine or not. But is there any discussion around that?
HPPC aren't the decision maker there. It is the Australian Technical Advisory Group on Immunisation, ATAGI. You know, if their advice is that there should be a shift in age groups and specific vaccines, I'd support it. They are the experts in that area. It would probably make a difference for some people. I know that vaccine hesitancy has been greater for AstraZeneca vaccine, and so ATAGI would obviously bear that in mind as well in terms of uptake, but at the moment that's not an HPPC discussion. In terms of the youngest age group, you need a vaccine that's approved through the TGA in Australia for use down to that age group. But as soon as it's a registered vaccine on the Australian Register of Therapeutic Goods and that there's an ATAGI recommendation to use it, terrific to roll out.
Sorry, just elective surgery, sorry. Just in regards to elective surgery, elective surgery resumed in regional Victoria the day after they came out of lockdown last week. Why did we not follow a similar timeline here in Melbourne? Why wait till Tuesday as opposed to today?
So I'm sure our regional hospitals followed the same gearing up of returning to elective surgeries. I just felt it was important as soon as a decision was made, and there's been some quite detailed discussions between the department and our health services about how quickly we can ramp up elective surgeries. So I wanted to be clear with people that we are doing that, and that will start from Tuesday. There will be a similar ramp up in regional Victoria, but we've got regional Victoria opening up for elective surgery. Metropolitan Melbourne hospitals from Tuesday next week. But importantly, Category 1 and urgent Category 2s have continued to be delivered throughout the pandemic.
Acting Premier Steiner has seen CCTV of a security breach inside the Novotel Ibis quarantine hotel, in which someone went into the car park and stole a number plate off an ADF vehicle. Are you aware of this?
I've asked that question because I was aware of the report. My understanding is neither VicPol nor CQV were advised of this alleged theft, so I'm happy to get CQV and VicPol to come back to you.
And what is that? Sorry, just to follow on that. Sorry, just one follow. What does that say about the level of security? Do you have any concerns?
Well, you're putting that to me, and that's fine. What I'm saying to you is that VicPol have not been advised about this allegation. CQV have not been advised, so I'm happy for them to come back to you. But that's the advice that I've got.
And on Wednesday, we asked if we could speak to someone from CQV, and you gave a nod to us, and we get to put those questions to CQV. When will we be talking to Emma Casa or Danny Pearson?
I'll follow up straight after this press conference to make sure that CQV are in touch with you.
In terms of demand for vaccines, James, there are reports of people who've had their first dose of Pfizer, and either they're finding it impossible to book a slot to get their second dose, or they're having to call around 7-8 GP clinics or mass vaccination clinics. Have we overcommitted on Pfizer vaccines? Do we have the supply to back up how many people we gave that first dose?
I was at National Cabinet just a week ago today with clear advice from the Commonwealth that they've got the second doses in stock. So go and deliver all of the vaccines that you have. This was, a communication, a direction to states and territories. Don't worry about second doses. You go and deliver everything you've got. Now, we are doing that. 93% utilisation, 40% of the nation's vaccine is happening in Victoria. As soon as we're getting supply, we're getting it into people's arms. The vaccine program, as it has always been, has been dependent on supply and confidence in supply from the Commonwealth. I'll follow up that particular question in terms of do we have capacity for the second dose for Pfizer, but the confidence that the Commonwealth provided to states and territories last week is that we have all the second doses that we require.
Why are people having to call around in the first place? Why don't we have a system where if you get the first one at the convention centre, you're automatically booked in 3 weeks later to come back to the same place? You must agree it's not ideal for people having to scramble around themselves.
Look, all I can say is I appreciate people's patience and perseverance in terms of booking for a vaccine, getting vaccinated, and then booking for your second dose. We are trying to make it as easy as possible. This is a race. This is a race. That's why we're trying to get as many out as quickly as we can. We want that confidence in supply, so we can, with confidence, deliver the second doses, with confidence, expand the eligibility. At the moment, it's everyone 40 and over. I would love to expand the eligibility even further, but we need that confidence in supply.
Premier, what level of risk are you willing to accept to open up at some point in the longer future? England's opened up, others have opened up, we get vaccinated. What's the point? What's the level of risk you're willing to accept on the government to keep us open?
Well, I just point to other jurisdictions where their populations are more than 50% fully vaccinated and a much higher figure with their first jab. We've got a delayed rollout of the vaccine, a delayed rollout of the Commonwealth vaccine program in this nation. It's not a criticism, it is a fact, and that's what we are dealing with. So the sooner we get our community vaccinated at a much higher proportion, the more comfort is provided to public health in terms of our response to any particular outbreak. But outbreaks are dealt with on their merits, and the number one criteria for the public health team, for the government on behalf of the people of Victoria, is to keep people safe, to make sure that this outbreak doesn't become uncontrollable. That is our response to every single outbreak. Now, in some circumstances, when it's localised, when we can track it down very, very quickly, there is no need for a circuit breaker. In other circumstances, where we've had generations of transmission, right across exposure sites right across the state, thousands of primary close contacts, we have had the advice to go into a circuit breaker lockdown. Now, I can't, no one's got a crystal ball in terms of what the future may hold, but what we do know is that our way through this is getting people vaccinated and having purpose-built quarantine facilities for our highest risk individuals. That is the pathway through this. That is the race. That is the race we are all on. citizens, governments, state, territory and federal.
Can I just ask something else about the pathway? I realise this is a bit blue sky thinking, but Brendan Crabb, I think the government respects the Burnet Institute. He wants some sort of airborne transmission commission, you know, some national measuring stick so you can say this school has good ventilation, this pub has good ventilation. Don't we need to pursue that so that you don't need blanket lockdowns? Is that something that's worth looking at?
Raf, I don't want to talk off the cuff because that's a very specific and technical question, and I respect the person that is putting that to you. I can say that the assessment of hotel quarantine, the ventilation assessment of hotel quarantine, very detailed. The works that were required were undertaken. Doing that statewide, thousands and thousands of school buildings, tens of thousands of venues. By the time you do that ventilation assessment and then do the works, you may well be talking a very, very long period of time. But that's just my sort of immediate response to that question. I'm happy to come back to you in detail.
Can I ask you though? I mean, you were saying before about vaccinations. Do you think, because you've been under attack from business groups and particularly small business, do you think they should be directing their attacks to the Commonwealth because of the slow rollout of vaccinations?
No, Dennis, I don't think it's about directing attacks or directing blame. We understand absolutely that this has had a significant impact on everyone, on every Victorian, on every family, on every business. It's why we've got our business support program. It's whilst during the time that it was identified as a hotspot, the Commonwealth provided assistance to income assistance to Melburnians. So I don't think it's about directing people's anger. I'm just laying out the facts. Our path through this, like every other place in the world with this global pandemic, our path through this is vaccinating our citizens. It is as simple as that. Now, right now, we've got Victorians vaccinated, about 2 to 3% are fully vaccinated. 20-odd% have got one dose. We need to be so much higher than that, and that is the race that we're all on.
Just on floods, Tim and Acting Premier, 9 minutes ago, the SES just reissued the Evacuate Now order for Traralgon. How concerned are you, Acting Premier, about that region with flooding to return, likely flooding to return?
It's incredibly concerning, and that's why we've got Tim here today as Chief Officer Operations to send those important messages out to the community. Be aware of your local circumstances. Make sure you're looking at the Emergency Vic app. You're keeping an eye out. If there's an evacuation order, please get out. These are very, very serious circumstances. It was wild, wild weather over the last couple of days. We've had already one loss of life, which is absolutely tragic. We do not want to see any more. So please take notice of the evacuation orders and work with the wonderful SES volunteers and all of our emergency services that are out there keeping you safe.
In the wake of the bushfires, your boss, the Premier, Daniel Andrews, said that Victoria would probably utilise the ADF more when it comes to emergencies, particularly after what happened in Gippsland. Have you or the government contemplated asking the ADF for assistance with this disaster event?
Not at this stage. I'll ask Tim to respond in terms of the resources that we've got out there. Often in disaster scenarios, we have support coming in from interstate and elsewhere. If it's a disaster in New South Wales or any other part of the country, we often have CFA, SES personnel going there. But in terms of resources, I'll go to Tim.
Acting Premier, before you go, can I ask one other quick question about elective surgery? Is the government working on a plan so that any potential future lockdowns we won't have to suspend elective surgeries?
It's like all the settings that we put in place. A lockdown is an absolute last resort and impacting whether it's students going to school, whether it's people getting their elective surgery attended to. That is our priority, but you can't ignore the public health impact on our health services, in education, on business. Sometimes it is unavoidable. We want to ramp it up as quickly as possible, and that's what we've committed to from Tuesday next week in metropolitan hospitals.
Just one more before Tim. Can I get clarified with people outside of Melbourne, regional people, if they say, for instance, fly into state and they go through Melbourne Airport, what's the situation with them? Because that's not a hotspot, is it?
No, but Dennis, you can only travel into Melbourne for certain reasons. In terms of does that allow people to fly, I'll come back to you. I just don't want to give you a definitive answer.
Yeah, on
when I'm not 100% confident on my answer.
Where are we at with the online booking function for COVID-19 vaccines?
We are testing it, as I understand, through the department, and that is happening. I understand through this week, but I'm happy to come back to you in terms of exactly what the department is doing with that online booking system.
Last question. Have said that outdoor masks are a burden on Victorians with very little health advice. What do you make of that statement, and do you have full confidence in our public health team?
Yes, I do, and frankly, both Professor Sutton and Professor Cheng yesterday went to the reasons why that this was a slight tweak in the settings that we've got for the next week. But I should go to Tim to answer the question in terms of resources.
So, Tim, you've obviously got resources coming in. I understand Surf Life Saving have been even helping in Gippsland. Is there any thought, or are you happy with the level of resources, or have you thought about requesting the ADF?
Yeah, look, at this point in time, we've got all our emergency services engaged, both with the clean-up of the storm damage, but also the flood response. We're satisfied at this point in time that with our SES volunteers, CFA volunteers, we've also got Life Saving Victoria with their remote piloted aircraft. We also have Fire Rescue Victoria and a range of local government and industry groups that are helping us with the clean-up and also the flooding, that we do actually have the resources in the state at this point in time with what is currently forecast. Obviously, as we go into the coming days, if we start to see renewed weather conditions coming, then they're the considerations we take all the time about how we manage fatigue and manage our resources.
Yeah, one more. In terms of the Melbourne couple that drove to Queensland, did Victorian authorities interview them yesterday, and what did that bring in terms of whether they broke any rules and in terms of any exposure sites or how they got the virus down here?
Yeah, so as we heard from Professor Sutton earlier, Victorian officials did interview this couple, and there's likely to be exposure sites that will come up in the usual way through the course of today. I don't have any further details in terms of the outcome of those very detailed discussions. First and foremost, Queensland and New South Wales Health Authority and Queensland Police, and then our detailed interviews with them yesterday.
We confirmed that they were relocating and therefore they're allowed to leave Victoria?
I don't want to speak on behalf of Queensland Health, so as I've said a number of times, relocating from Victoria to another jurisdiction doesn't contravene Victorian directions, but people need to be granted exemptions via other states and territories. In terms of that detail, I'll wait for Queensland Health to confirm.
They're not going to get fined. There was talk yesterday they might get fined in 3 jurisdictions if they broke the rules. They're not going to be fined here because they're allowed to relocate.
Well, let's see what the outcome is of their discussions and the interviews with Queensland Health, see if anything was wrong at that end. But relocation as a reason is not a contravention of our directions.
Gymnastics, obviously they're closed. Is it true that students at school can perform, like, partake in dance classes while on school property?
There's activity at schools, so all students are back at school today, which is a great thing. We're limiting inter-school competitions, but in terms of normal activities at school in a COVID-safe way, that is allowed.
On that advice, then why can't dance schools and gymnastics classes open up again?
Because they are known, and the evidence shows that they are high risk settings, whether it's gyms, nightclubs.
So this isn't gyms, I'm talking about gymnastics.
Gymnastics, yeah. So I'll come back to you in terms of exactly what is allowed at schools in terms of participation in those sorts of activities. We certainly will limit for a period of time inter-school sporting activities.
And just one more, I asked Professor Sutton this, but I'd like to get your response. Do you acknowledge that some of these restrictions do appear to be contradictory to the everyday Victorian?
I think, you know, if you look at something in isolation, you know, I can understand that response. But as we've heard from Professor Sutton, it's the cumulative impact. So we've got some pretty tough settings at the moment for private gatherings. So regional Victoria, 2 adults plus dependents can visit once in any one day, or once per day rather. In Melbourne, no visits to the home. So you know, you look at that rule, and then you can pick any other restriction that we've got. It's the cumulative nature of and the risk in terms of people visiting homes. There are reasons why these settings are in place. I know it's difficult for families, I know it's difficult for businesses, but every setting that we have in place, there's a reason for that. In terms of private gatherings, in terms of what we will do for QR check-ins in the workplace, because through this latest outbreak, we saw greater levels of transmission in an office environment. So there are reasons why we have these settings in place. We want to get out of it as quickly as possible. We don't want to get into this situation again, but it's always based on public health advice.
Sorry, Acting Premier, just to clarify, did the rule to keep masks on come from the Chief Health Officer or from ministers? The rule to keep masks on, did that recommendation come from the Chief Health Officer or ministers?
As always, from the Chief Health Officer, from the public health team. You know, there was the clear advice was that because of that, because of the recent cases in Reservoir and the Queensland couple, the advice from public health was that we needed to tweak our easing of restrictions for metropolitan Melbourne and remain or have people continue to wear masks outdoors.
Your boss would usually say, or he has said in the past when we've come out of lockdown, that he'd go higher up the shelf or that it's time to get back on the beers. Is there something you'd like to say to Victorians along those lines as we enjoy our first night out of lockdown?
Look, I think I said right at the start, we should just take one moment to take a breath and congratulate each other. Victorians have done an awesome effort in getting tested, getting vaccinated, following the rules. We're not out of the woods yet, but today having 0 cases is a great reflection of the work of all Victorians.
Following up with his doctors this week, he had medical appointments. Is there any update on when he might be back from those?
No update from me, no. So I know that following doctor's advice, Dan will provide some further details in terms of when he's able to return to work, but I've got nothing to add to that.
Are you looking forward to stepping back to just being a minister, or do you want to keep this role as acting?
No, I'm very much looking forward to the Premier resuming duties. It's a great honour to be acting Premier, particularly for such a period of time. But I love being Education Minister. I love being Minister for Health, and I will love it when Dan comes back on the job, and hopefully that's very soon.
As Education Minister, we've heard that some schools are taking a curriculum day on Tuesday. That seems a bit strange.
Yeah, Dennis, we've been really clear with schools. We had a pupil-free day in the lead up to schools going into remote learning. There's no statewide pupil-free day or metropolitan-wide pupil-free day for schools. The clear message from the department to all our government schools is we want to prioritise return to face-to-face teaching, and that's what's happening at schools right across the board. We've said to schools, if you have a curriculum day, and some schools plan out curriculum days a year in advance, they might have guest speakers, but we've said to schools, if you can postpone a curriculum day, you should. So there's no pupil-free day. We want all students back at school face-to-face, and the department's made it very clear to schools that if you can move any planned curriculum day, you should.
just one more from me. There was reports today that an internationally regarded panel of experts called for states to keep schools open regardless of lockdowns. Is that something that you guys will commit to looking into in future?
Well, moving to remote learning is always a last resort. It is always a last resort. So I think that's my very firm answer. We want students in schools, we want teachers and staff teaching face-to-face with our kids. As we saw during last year, we wanted to prioritise Year 11, 12s, the young Prep 1, 2s. This year, with this short period of lockdown, we had Years 11 and 12 back at school Friday last week, and we've got all students back at school today, and that is a great outcome. It is always a last resort. All right, thanks everyone.
Thank you.